I'm not afraid of the surgery itself. I'm more afraid of feeling severely nauseated after anesthesia. Many patients are surprised to learn that postoperative nausea and vomiting are among the most unpleasant memories associated with surgical treatment. In some studies, patients have even reported that they would rather experience moderate pain than severe nausea after surgery. Fear of nausea and vomiting is entirely understandable. These symptoms can cause significant discomfort, weakness, and a general sense of feeling unwell, potentially overshadowing an otherwise successful surgical experience. But how common is this problem? Can nausea after anesthesia be prevented? And what does modern medicine do to reduce this risk? Let's take a closer look. What is postoperative nausea and vomiting? In medicine, the term postoperative nausea and vomiting, PONV, is used. PONV refers to the occurrence of nausea, retching, episodes of vomiting, an unpleasant sensation of stomach discomfort following surgery and anesthesia. Symptoms most commonly occur during the first few hours after surgery, although in some patients they may persist for 24 hours or longer. How common is postoperative nausea and vomiting? Postoperative nausea and vomiting are among the most frequent complications associated with anesthesia. On average, PONV affects approximately 20 to 30% of patients. However, among individuals with multiple risk factors, the incidence may increase to 60 to 80%. This means that anesthesiologists are very familiar with this issue and have developed effective preventive strategies over many years. Importantly, in most cases, PONV is a temporary and reversible condition that responds well to treatment. Why does nausea occur after surgery? The causes of PONV are complex and multifactorial. Several factors may contribute to its development. Anesthetic medications. Some anesthetic drugs can stimulate areas of the brain involved in triggering nausea and vomiting. This is particularly true for inhalational anesthetics and certain intravenous agents. Pain medications. Opioid analgesics used to manage postoperative pain are among the most well-known risk factors for PONV. Type of surgery. Certain surgical procedures are associated with a higher likelihood of nausea and vomiting. These include laparoscopic surgery, abdominal surgery, gynecological procedures, ear surgery, ophthalmic surgery, plastic and cosmetic surgery. Individual susceptibility. Not all patients respond in the same way. Some individuals appear to have a greater natural predisposition to developing nausea. Do you belong to the high-risk group for postoperative nausea? Several well-established risk factors for PONV have been identified. The likelihood of experiencing symptoms is increased in patients who are female, non-smokers, prone to motion sickness, have experienced nausea after previous surgeries, receive opioid medications after surgery. These factors form the basis of widely used risk assessment tools for predicting PONV. If a patient has multiple risk factors, preventive treatment can be planned in advance. How dangerous is postoperative vomiting? For most patients, PONV is not life-threatening. However, severe or prolonged vomiting may lead to dehydration, electrolyte imbalances, increased blood pressure, worsening pain, delayed hospital discharge, reduced overall well-being. In some situations, postoperative vomiting is particularly undesirable. For example, after eye surgery, after brain surgery, following facial plastic surgery, after surgery involving the esophagus or stomach. For this reason, preventing PONV is considered an important aspect of modern anesthetic care. Can nausea after anesthesia be prevented? Yes. Today, several effective preventive strategies are available. Risk assessment. Before surgery. Before the procedure, the anesthesiologist evaluates the patient's likelihood of developing PONV. This allows for an individualized prevention plan. Modern anesthetic techniques. In some situations, total intravenous anesthesia may be preferred because it is associated with a lower incidence of postoperative nausea. Anesthesiologists may also try to minimize the use of medications known to increase the risk of PONV. Preventive antiemetic medications. Today, several classes of medications are available that can substantially reduce the likelihood of nausea and vomiting. These drugs may be administered before surgery, during the procedure, or in the early postoperative period. Often, combinations of medications acting through different mechanisms are used. This multimodal approach is particularly effective in patients at higher risk. Effective pain management. Reducing the need for opioid medications can also decrease the incidence of PONV. Strategies may include regional anesthesia, local anesthetics, multimodal analgesia. What should you do if nausea occurs anyway? It is important to remember that postoperative nausea is treatable. If symptoms develop, patients should inform the medical staff promptly. The physician may prescribe additional antiemetic medications, adjust pain management strategies, provide intravenous fluids, tailor treatment according to the patient's individual needs. Patients should not feel that they must simply endure severe nausea while waiting for it to resolve on its own. Modern treatment options can significantly improve comfort for most patients. Should you tell your doctor about your concerns? Absolutely. If you have previously experienced severe nausea after surgery or are prone to motion sickness, it is important to discuss this with your anesthesiologist. This information helps the physician assess your risk more accurately, choose the most appropriate anesthetic technique, prescribe preventive medications, make the recovery period more comfortable. For anesthesiologists, this information is highly valuable in clinical practice. Fear of nausea is common, but modern medicine offers effective solutions. Fear of nausea and vomiting after surgery is understandable and shared by many patients. Postoperative nausea is indeed one of the most common complications associated with anesthesia, but in most cases it is temporary and responds well to prevention and treatment. Modern anesthesiology offers effective methods for risk assessment, prevention, and management of PONV. As a result, many patients either never experience this complication or experience it in a much milder form. If you are concerned about nausea after surgery, discuss it with your anesthesiologist before the procedure. In many cases, an individualized approach can significantly reduce the likelihood of unpleasant symptoms and make recovery more comfortable. If you found this video helpful, don't forget to like, subscribe, and turn on notifications for more content.